Hello, and welcome to Health Matters. This is a program of the Worcester District Medical Society. Today with me, I have two physicians who are going to talk to us about the effect of COVID on children attending school or attending virtually. And I'd like to introduce them. First, we have Dr. Michele Parker. Dr. Parker received her medical degree from the University of Massachusetts Medical School, completing her residency in family medicine at University of California, Los Angeles, and then a fellowship in rural family medicine in Tacoma, Washington. Currently, she serves as the president of the Massachusetts Academy of Family Physicians. She's also a school physician for the Narragansett Regional School District in Templeton, Massachusetts, and serves on the Board of Health for Gardner, Massachusetts. She and her husband, Dr. Michael Mechler, own Cornerstone Family Medicine, which is a direct primary care practice in Gardner, Massachusetts. So welcome, Michele.
Thank you.
And also with me is Dr. Lloyd Fisher. Dr. Fisher is a general pediatrician at Reliant Medical Group here in Worcester. He also serves as the chief of community pediatrics for the University of Massachusetts Medical School and Medical Center. And he's also the associate medical director for informatics at Reliant. He is currently the president of the Massachusetts chapter of the American Academy of Pediatrics, received his medical degree from the University of Massachusetts, and he also completed his residency in pediatrics at UMass. So welcome to you, Lloyd.
Thanks so much.
Thanks for joining us. So I'm Dr. Lynda Young. I'm a pediatrician here in Worcester, retired, but still I'm keeping an eye on all this stuff that's going on with children. So I think people have realized the devastating effects of this, and I'm going to open this up, first of all, I'm going to have Lloyd start first, and could you talk to us a little bit about the terrible impact that this has had on our children?
Well, one of the things that we know, Lynda, is that children gain so much more than an education from the experience of going to school. For many children, they depend on their nutrition. They receive free breakfast, free lunch from the school system. Many of the school districts across the Commonwealth have done a fantastic job of finding ways to provide those meals to the children and their families during the pandemic. But so many of them are still not receiving the adequate nutrition that they used to receive in the school building at least 5 days a week. We're also starting to see a very troubling trend in an increase in significant depression, anxiety, and feelings of social isolation. I know all of us pediatricians, family physicians, and anyone who cares for children during this pandemic have been seeing every day in our office how these children are truly struggling, and sometimes, especially the younger children, don't really have words to express why or how they're feeling. But we're seeing just this social isolation. They're missing that experience. They're missing the adults in their lives that they are outside of their family, the trusted person, their teachers, their school social workers. For children with special needs, so many of them receive services such as physical therapy, occupational therapy, speech therapy, applied behavioral analysis therapy, which is what children with autism need to help with their growth and development. And one of the other things that's becoming very concerning is the rise in obesity that we've seen. Even prior to the COVID-19 pandemic, obesity in children and adolescents was considered one of our top health crises in this country. And during this time where children are not going to school, they're not going to gym class, they're not having recess, they're staying indoors and spending much more time in front of a screen, we are seeing a dramatic rise in weight. And we're very concerned that this is going to lead to lifelong medical problems if we don't find a way to get these children more active.
And Michele, anything to add to that? Because there's so much to that question.
Yes, there's a lot that's affecting children, but there's also a lot affecting families, and Lloyd mentioned that as well. But we see a rise in stress and anxiety for the parents who are trying to function as school teachers, even though that's not their area of expertise. And they're also struggling with things like trying to be at work and handle the hybrid learning or remote learning. They are struggling with higher incidence of substance abuse as well. There's been a lot of issues with poverty that's escalated because of the pandemic, people losing their jobs and being out of work, small businesses suffering, and so that affects the whole family, and that trickles down to really affecting our children. I know we're focusing on schools, but I think it's a whole
there's
a whole
yes.
village of
Absolutely.
issues. So I think getting the kids in school is part of getting things on track for those families.
So I think one of the things that we hear about is you have to be, like we are here, socially isolated. They have to wear a mask. They have to do all kinds of protocol that is very scary to some children. And I think a lot of it is that it's meant to stop the spread or help to stop the spread. So what do you think about what's the likelihood of kids making people sick with COVID?
So children have a higher chance of having milder symptoms, but they can transmit the virus to parents and grandparents. And so again, looking at the whole picture, we're trying to be cautious about exposure to other high-risk members of the family unit. But actually in school, there's very little student-to-student transmission. If they're doing their social distancing, wearing masks and hand sanitizing, there's been less of that than household transmission. So most kids are at risk of getting it in their own household.
Yes, and I'm glad to hear that because I think that's very important. Lloyd, how about in other parts of the world? What have other countries done about this?
It's really interesting. There are many countries that have either closed for a very short period of time their schools or reopened earlier during the pandemic because of their school schedule where they go to school through during our summertime, or have never closed. Some countries actually never closed. And what we found in looking at those countries is there is very little evidence of child to adult transmission within the school. There is some adult to adult transmission. However, in the countries that instituted good protocols for mask wearing and physically distancing, we just haven't seen that. And even in our own country, where we had child care centers that have actually been open throughout the entire pandemic, the YMCA programs, which provided thousands and thousands of children of essential workers with child care, we just did not see really any transmission among children to children or children to adults, which has been very encouraging.
Yes, that is very encouraging. I don't want to get too far into the weeds about what's the difference between a hybrid model of learning and going to school full-time in person versus being virtual. So I'd love your opinions on any of those methods. And we already know that they should be in school, but right now, especially for Worcester, that is not the case. And because Lloyd, you work with the Worcester Public Schools on this. So
yes.
What do you see happening down the road?
You know, I see these children in my office every day, the ones that are fully virtual, and you know, for them, we really need to support them and do what we can to give them the best environment possible to learn at home. And unfortunately, this is where we really see a lot of inequities based on socioeconomic status specifically. We have these children who are trying to go to school at home. Their parents are often essential workers. They're working multiple jobs. They're just not there every day to help their child, especially the young ones that are trying to learn. You know, I have a 7-year-old myself who's still in the early phases of learning to read, and I'm sometimes working from home. My wife is sometimes working from home, but we're still there and able to provide that support. For so many of my patients in the Worcester Public Schools, they have parents who aren't there because they're working. They're providing food for their children. And sometimes many of my children from immigrant families, they don't have parents who even speak English as their primary language. So for them, it's extremely challenging. And then, of course, there's the technology issues. Not every child has access to a device. The school systems have been fantastic of finding devices, finding Chromebooks and laptops to give to the children. But it's not always enough. And if they don't have internet access in their home, I've heard stories of children going to parking lots outside of restaurants that have free Wi-Fi in order to be able to do their virtual learning.
And I think, too, the public libraries used to be the ones that provided a lot of internet access, but they're closed.
Right.
So it is very difficult. Anything to add to that, Michele?
Well, Narragansett school system that I'm involved with is a hybrid model. So it's been very interesting touring the school and seeing a phenomenal job that the school nurses have done. They've really set it up so that the kids have very clear rules about social distancing, from getting on and off the bus to, how they're going to have their paper bag that they take home for lunch. And even if a child is positive, they have isolation room and PPE for the school nurses. They have really put a lot of thought and effort into doing this safely, and I think they should be commended for making that work. And so far, it's been working very well.
And PPEs are?
Oh, personal protective equipment.
Yes.
It's mostly the masks and N95s, and they have gloves. They do have gowns. They are trying to really keep any children with symptoms in a special room. Right now they're doing it with sort of windows open and ventilation. That will become more challenging when it becomes colder and we're inside more. But so far they've got this all prepared to handle that event of a child positive at school or symptomatic at school.
Yes, and that leads us in. I just want to say one more thing as far as virtual learning. I was speaking to someone who has a son doing all virtual, not in this state, but the parents give their cell phone numbers to the school, and if the child does not log in, they know that, and they call the parent. Now, that's an extra lot of work for a teacher to have to go through, but because I used to think, well, how do they know whether they're there or not? And that's one of the ways that they look at this. So I thought that was kind of interesting. So I'm gonna follow up with, we were talking about mask wearing, and I think that's been a big issue with kids. What I'm hearing from just asking around and people talking with me, that it really isn't such a big deal to the kids. So what do you think?
It's true. I think we've all been quite impressed at how well children have done with wearing masks, even for prolonged periods of time. 6 months ago, I think all of us were a little bit concerned about how is a child going to be able to do this. And yet we've seen great evidence that they can do it. In fact, most of the time the children are far more compliant than their parents are. You ask a child to put on a mask, and they are able to do it. I know I asked my 3 kids that are 7, 9, and 12, when we first heard about these guidelines, I said, if you have to wear a mask to school all day, what do you think? And they said, if we can go to school, we're willing to do anything. I think the most important thing, though, and what I've been telling all of my patients and encouraging other pediatricians and family physicians to do with their patients, is modeling good behavior. We know that if the parent wears a bike helmet, if the parent wears a seatbelt, the child is much more likely to wear those things as well. And by the same token, if the parent isn't modeling good mask-wearing behavior, then the child isn't going to do it. They're not going to copy them. We need to set the example for our children. And I've been recommending that parents bring their child to stores, wearing a mask, being socially distanced. Let the child see how everybody is keeping themselves safe and they're still able to do some of these activities. And the same thing goes for the school. The child just needs to see that behavior.
And you also had some concerns about that. So with mask wearing and that sort of thing.
Yes.
So
most of the kids in school get a mask break. Like every 2 hours they are allowed to take their mask off and breathe a little bit. But they actually, very few kids struggle with this, and there are very few reasons not to wear a mask. Even kids with asthma and anxiety and even autism can learn to get used to the mask if you explain it in a very simple way. Explain that the mask is a way of taking care of other people, that the mask prevents the virus from jumping from one person to another, just in very simple terms about why it's a good idea. And the kids are super resilient. They've really gotten used to it very quickly.
Those are really important points about just telling the kids why they need to wear them. I know I was talking to my 6-year-old granddaughter, and I asked how you're doing with the mask, and she said, I don't mind it. She said, I really don't like the shield, because we can wear a shield if we want to, but they're too hot. So she's fine with it. She said, I just leave my mask on all day except when I eat lunch. So I think, in a way it surprised me, because I was thinking, oh my gosh, this is going to be just a tragedy to see all this happening. So let me move on a little bit more to what happens when a child gets sick at school. I'm going to have Michele start that.
Sure.
So as I mentioned, the nurses are all over this. They have a way to shuttle them right down to the nurse's office in a special area that's separate from the main nurse's office. It's an isolation room. And they can put several children in there that are socially distanced from each other, but they wear a mask until their parents can pick them up and bring them for evaluation. So we're asking people to call their primary care physician and to help make those decisions about where and how to be tested. But the child would need to be tested, and then the people in the classroom may need to quarantine. If anyone has been within 6 feet for more than 15 minutes, even with a mask on, then they need to be quarantined for 14 days. The child who is symptomatic needs to quarantine or needs to isolate for 10 days until their symptoms are resolved and they're afebrile, we also advise the family members who have been exposed to this sick child that they need to quarantine if the child is positive. If it's a contact of a contact, however, they do not need to quarantine. And I think the majority of the questions that I get are people who have secondary contact with someone who's positive or symptomatic. And it's been a challenge to reassure people that if you are just a contact of a contact, you're okay. You should monitor for symptoms, as we all should, on a regular basis. But that's the protocol for the kids in school.
Okay, thanks. So Lloyd, with a child, there's so many symptoms that you can have for COVID. And so if your child wakes up and has a runny nose, no fever, just a runny nose and a cough, and what should they do?
So the first thing to do if you have any questions is call your primary care provider. That's really the most important thing, or the school nurse. And as Michele said, the school nurses have been well educated in this, and they've been unbelievably out in front of this issue because this is really complicated, and we know that people are confused. But there are a long list of symptoms that would require a child to not go to school. Runny nose by itself is not one of them. So if you just have a runny nose without a cough, without a fever, without a headache or anything else, then that is actually okay, especially during the fall when there's allergy seasons and so many children do suffer from allergies. But really the first thing to do is to have contact with a healthcare professional, again, whether it's that school nurse or their primary care provider. One of the things that it's really important for parents and families to recognize is in prior years, we would always encourage children with very mild symptoms, a little bit of a cough, that runny nose, maybe a mild headache or a scratchy throat. You can still go to school. We don't want children to be missing school unnecessarily in prior years. That's not the case this year. The likelihood that these children with mild symptoms actually have COVID-19 is still low, but we don't know. And we want to be as successful as possible in keeping the schools open and not having any outbreaks or transmission in schools. And the way that we do that is for everybody, adults and children, if they have even some of these mild symptoms, to stay home and get tested.
So, Michele, you had mentioned to me about since this has been going on for a while, we must have some kind of information or some kind of data or some kind of facts. Can you fill us in on what we know now? And we don't know a lot, but what we know now.
There's a lot of information online, actually. You can get on and see how many schools in Massachusetts have how many cases. And in the first week or so, there were about 60 cases of students and 30 cases of staff, adults transmitting the virus. But they feel that a lot of that is from households and not happening in the schools. In the second week, it was up to 100 children and about 50 adults. So it's increased the second week, and we're awaiting the next week of data. But again, it seems to be happening more in family gatherings and household contacts. We're following the college situation very closely because Massachusetts has a lot of colleges. Boston and Worcester have a lot of colleges. And nationally, there have been 178,000 cases in colleges and universities. And here in Massachusetts, closer to 1,100. There have been a couple of deaths nationally, but they were more in the spring and they were more related to staff than students. And so being young seems to be protective for severe COVID, and it's more the staff that we worry about more than the students. But a lot of the colleges have gotten a lot more strict about the parties, fraternity and sorority parties, and people getting together in dorms. Some schools have been very strict in dismissing students who cannot follow the social distancing rules, and some colleges are testing students and faculty regularly. And so all said and done, most of the colleges are doing quite well with the outbreak and keeping it under wraps.
But yes, that's true. And again, you brought up testing. So that is so confusing. So when we're talking about testing, is it just the nasal swab? Is it a throat swab? Is it a blood test? Who would like to pick up on that one?
So there's a few different types of tests, and it's very confusing. We've actually, our chapter, the Mass chapter of the American Academy of Pediatrics, has put out a patient tip sheet and a physician and provider tip sheet that goes through all of the different testing, and you can find that on our website at mcaap.org. But really, there's a few different types of tests. There's what's called an antigen test, and this is something that is a quick test, oftentimes, but it's not as specific. So sometimes, or not as sensitive, meaning it can sometimes miss people that have early disease. The test that we recommend for school return is what's called a molecular test or a PCR test. And this is the one that we have very good confidence in. That being said, the antigen tests are actually getting a lot better. So it may be very shortly that we can be very confident in the results of the antigen test. And they're also developing faster molecular tests. So there's some now tests that can get results in 15 to 30 minutes, even from this PCR test that's very, very sensitive. The antibody test, which is the blood test, is not a test that is useful, at least currently, for looking at current infection. An antibody test gives us evidence that someone has had the infection, but we don't know when. It could have been recently or it could have been 6 months ago. So an antibody test is not something that's useful in this situation.
Anything to add to that?
No, I think that covers it very well. The antibody test can be used to help people decide to donate plasma, and it also does not tell you that you are immune, meaning if you have antibodies, you still have to wear a mask, you could be reinfected. So it's really not the reassurance that you would expect.
That's true. I think one of the biggest things and all of the controversy and everything is over a vaccine. So what do you think about the development of a vaccine, all the different ones that are out there being tested? Any thoughts on that?
Yes, I think that's very exciting, and I feel like next year at this time when we're bringing kids back to school, we're going to have a lot more ammunition against managing this virus. There may be vaccines, there may be antibody tests, antibody treatments, and antivirals that we can rely on. The vaccines, there's several that are in studies right now. A couple have been suspended due to unexpected illness in the volunteers, which can happen and may not be related to the vaccine, but it has to be investigated. So it's slowing the progress a little bit. I think we're all antsy to try and get a vaccine as quickly as possible, but the key is to get it safely. And so you don't want to rush the research, the clinical trials with thousands of people. Make sure that it's effective and that it's safe. And so you have to wait that out. And until we have a vaccine, our social distancing is our best ammunition. And we know that it works. We just have to be patient and stick with the plan.
Well, the other thing, too, is we do have a vaccine for flu. And I think that is something that I'd love to hear any of your thoughts, either you, Lloyd, or you, Michele, about the importance of how flu affects children and the importance of getting a flu vaccine and knowing and the mandate that's in our state.
It's interesting when you look at the data on flu, and we know that COVID has been really the most devastating disease in all of our lifetimes. But when you actually look at the effect on children, flu is far more deadly and severe to children. We have had more flu deaths in the 2019-2020 season in children than there have been COVID deaths. And despite schools being closed, there was still a high rate of flu and a high rate of severe illness. Far more hospitalizations, far more ICU admissions, and unfortunately far more deaths. So flu is a really severe illness in some children. And for most, yes, they feel ill for a week to 10 days and they recover, but that's not always the case for flu. So a flu vaccine is by far the most effective way that we can protect all of us, and especially our young children, from influenza. There's now a flu mandate in order to go to school, to daycare, and even to college in this state, which is really a great thing because we know that we need to keep flu rates low in this state for a variety of reasons. First, we don't want to overwhelm the healthcare system with people with influenza when we need to be treating children and adults that are going to contract COVID during this winter. So we need to keep the hospital beds available for those patients and not flu patients. We also know that the symptoms are so similar that if anybody develops flu symptoms, we're going to have to assume that they're COVID symptoms. They're going to have to quarantine and stay out of school, stay out of work, and get tested. So if we can keep the flu rates low, we can hopefully reduce that.
That would be great. What kind of resources do you see out there for parents and for teachers in the schools? I know there's a lot available, but what kind of?
Yes, in family medicine, we're spending a lot of our day counseling students and their parents, and as well as the nurses that are our patients and the teachers that are our patients. Everyone has the same concerns about staying safe, wanting kids to be educated and in schools, but being safe to do so. There are a lot of resources online. I'm a big fan of the mass.gov/COVID website, and there's a lot of information on there. Under a table of contents, you can find information on housing and places for even homeless people who are COVID positive to have a place to stay. There's things about homelessness and eviction and resources to help people with that. There are resources for even substance abuse and domestic violence, with both of which are up during this time. And I would encourage people to look at that website. There's a wealth of information there, or to call your primary care doctor.
The best one is mass.gov. We are at the end of this. This was a terrific segment. Thank you, everybody. Thank you to Lloyd. Thank you to Michele. And thank you for joining us. And I hope you learned something. And we will keep you informed about all of this as things go on. So thanks very much for tuning in.